Welcome. This is Jean Eaton of Information Managers. It is my honor and pleasure to be with you today at Practice Management Nuggets webinars. This is a weekly interview series with practice managers, healthcare providers, or trusted vendors who support healthcare practices. Our topics help primary care practice managers, healthcare providers, and owners to implement, maintain, or improve their business and practice administration so that healthcare providers can focus on providing quality healthcare services. I am your host, Jean Eaton, the Practice Management Mentor with Information Managers. This week, our guest is Jim Ewing of Provision Solutions of Edmonton, Alberta. Jim Ewing has more than 35 years' experience in finance and small business development, and he enjoys helping entrepreneurs find success. In his professional career, Jim managed the client service team at the Business Link in Alberta, one of Canada's most successful and innovative business service centers for entrepreneurs. As co-founder of Provision Solutions, Inc., Jim works collaboratively with entrepreneurs, communities, and organizations facilitating a smarter business growth, a business start, a growth, development, and mentorship. He has provided leadership to entrepreneur programs at the Northern Alberta Institute of Technology, also known as NATE, Metro Continuing Education, or the Edmonton Public Schools, and volunteers on NATE's Management Program Advisory Committee at the J.R. Shaw School of Business. So today I've had the opportunity to have Jim right here in our office studios, and that is a pleasant treat. Jim and I have met several years ago at the Business Link Center in Edmonton, and we have connected through the CAPS Speakers Association and through Toastmasters. It is my honor and pleasure to have Jim Ewing here with us to talk about the importance of business plans, a business plan checkup for your healthcare practice. Good morning, Jim.
Good morning, and thank you, Jean, for allowing me some time on your program today and to speak with your audience.
I'm delighted that you're here. I know that business plans are a really important part about healthcare practices. And one of the first things that I wanted to ask you this morning, Jim, is if there's nothing else that a business can do, if there's only one thing that a business practice can do today about their business plans, what would you suggest they do? What would be the number one tip for healthcare providers about business plans?
Well, I think, Jean, if there was one takeaway that I would leave with your audience today is to really focus on the reason why a business plan is important. And for me, in talking with your audience, I really believe that a business plan is for you. It's for you, those folks that are listening right now and are developing their businesses and their professional practices. The business plan serves a variety of different purposes, but number one, it's for you. That's what I'd recommend you take away today.
Okay, that's an important part. Sometimes we think about writing our business plans for financial institutions or our stakeholders, but it becomes our roadmap, so it's for us. Thank you for that. And I'm going to ask you to walk us through the purpose of having a business plan.
Okay, thank you, Jean. I really see there's multiple reasons for having a business plan. And for those of you that are tuning in and participating in this session today, I'm going to just suggest that all four of these reasons are probably valid, but maybe at different points in your professional career. So we'll take a look at different stages of business development or your professional practice development in just a moment here. But I really do see four main reasons why having a business plan would be important for you. So let's take a quick peek at those and see what you could identify with right now. The first one that I'm going to recommend for you is that preparing a business plan will really help you with a bit of a feasibility assessment. So on the front end of starting your practice, or even somewhere further down the road, if you're looking at changing your practice, this point will be very important for you. It helps you to evaluate your idea or your concept for your professional practice. And so I would encourage you to use it as a tool to help you evaluate what the potential is for this practice to become what you want it to be, and that is basically a viable business opportunity, or in this case, a professional practice. The second reason, and this is where I come from in my past life, years ago I was with one of Canada's largest financial institutions and looked after a portfolio of about 120 small business clients. And with that, I had to look after their personal banking requirements as well as their professional or business-related banking requirements. But very often, a financial institution is going to want to see something from you about what you are wanting to get into or what you're in right now, how it's doing, and where you want to go in the future. So a business plan is a requirement almost all of the time. Very rarely will they not want to see something or hear something from you about what you're wanting to do. The third reason for having a business plan is one that I think is really overlooked, but I would encourage you to revisit your business plan from time to time. Think about it this way. If you put time and energy into building a business plan on the front end of setting your practice up, why not take a look at it from time to time and simply ask yourself the question, how am I doing? I guess that's kind of what the purpose of our checkup today is all about. It's to give you an opportunity to reflect on where you are and where you want to go in the future. With entrepreneurs, Jean, I typically suggest that they take a look at asking the question, what have I wanted to do? Have I been able to achieve it? Or another way of looking at it, what's worked or what hasn't worked? What do I need to change in going forward? So just as we've been talking about prior to today's session, Jean, I really think that a business plan is something that all of us would want to do a checkup on a regular annual basis, at least. How have we done in the past and where do we want to go in the future? Does a business plan guarantee that you're going to have success? For most entrepreneurs, and I think there's a little bit of an exception here with our audience that we're talking with here today, but generally, for most audiences, having a business plan is not an ironclad guarantee that you're going to find success. But what I like about professionals in this field, the medical profession, with an aging population and with so many needs that we have as a society for health services, you folks are loved. You are appreciated. You are desperately needed with an aging population. And I look at myself in the mirror and say, I need the services that you folks provide. In fact, Jean, we were talking, I was just visiting my own healthcare professional, my doctor yesterday, and just a week ago met my dentist for my annual checkup. And they did a little fix-up from time to time. So you folks are needed, and I really do think that having a plan is going to help you to get yourself on the road towards success. And with you in a medical profession, I think the odds are very much in your favor.
So one thing that I just want to follow up on, Jim, is in our healthcare practices, we have the lead physician or the healthcare provider, it might be a chiropractor, podiatrist, an audiologist, or optometrist, any variety. And there's usually somebody who has started their practice. But the information in that business plan hasn't always been shared with the clinic manager, your management team, or perhaps they were the team that helped you get started, but they're not the team that you're working with now. So that business plan needs to be a communication tool within that whole organization with those key players to make sure that we have a clear understanding about what we want to do as a business. So we get caught up in the day-to-day work of having the patients coming in, providing a great service, and making sure that we're ready for tomorrow. But we need something that's going to help us be a more cohesive business to be able to manage that plan. So one of the steps certainly would be is reviewing that business plan and reviewing it with your management team. It's not something that should be sitting on the shelf. It should not be something that only the owner gets to see, because otherwise you're not going to have everyone on the same team.
That's an important part. It does take a team to have a successful practice, and I really do believe in the value of including those staff members that you have. And I'd even extend that further, which is maybe more tightly to sharing the confidential information within a business plan. If you have partners within your practice, other medical professionals that are involved in the ownership group of the practice, this business plan is very much important to them, and they will have input into the future direction of the collective practice. But Jean, the point you're talking about in terms of the staff members, from your business plan, I would say there are pieces of information that the professional should be sharing with the team to help the team move forward and get that practice to where you want it.
Excellent. Thank you. Next step.
Sure. Okay. Well, I think the reasons for having a business plan, we've talked about that. And I think if we were to take a closer look at the health of your business plan, um, there are a variety of different reasons why you would want to have a business plan. And I've already addressed some of those reasons right now, the 4 points that we talked about earlier. But what we want to do today is to take a look at what goes into a business plan, and we'll come back to this slide in just a moment. But we also want to take a look at what goes into the plan, and this slide here kind of alludes to a typical outline for a business plan. And um, and then we're going to take a look at some of the key things that someone in practice right now will probably want to take a look at. So I'm just going to move forward a little bit further. If any of you are familiar with the writing of Michael Gerber, The E-Myth and The E-Myth Revisited, if you're not familiar with that, I'd encourage you to maybe take a glance through that piece from the United States. Michael Gerber basically refers to the many different roles that the entrepreneur or business person has to keep an eye on. Most business people and professionals too are technically excellent. They do very good work in the space that they are operating within. But that doesn't necessarily mean that you're a good marketer or manager of a business or a practice. And it doesn't necessarily mean that you're going to come up with the new innovations and changes that need to occur. So input from the team will be very, very important. So the 4 stages that I would maybe see within a practice, and the business plan can be a tool to help support you. So I've got that slide up right now that I think you can all see. The practice itself, when you're starting, the pre-startup stage, your plan can be very helpful for you to identify what you want to accomplish and how you are going to go about getting that done. Who's going to be involved? What systems and procedures are necessary for you to move forward with that? A little further on in your professional career, as you're building your practice from its infancy through that growth stage, maybe in the first few years of the growth of your business, you'll be asking yourself what worked, what didn't work, and where do I need to make some changes to refocus the practice moving forward. I would encourage you to think a little further down the road too, with the long-term prospects for the practice. Start thinking about the exit strategy that you might have for your practice. Don't let that slip by without giving some thought to the longer term future for the practice, although it's still probably years away from you. The third stage would be maintaining. You're an established practice now. You're probably fairly comfortable. You've got systems in place and things are probably going quite well for you. The question to ask is, where do you go from here? How do you keep things moving smoothly, optimized, efficiently? How do you maximize the return that you receive and perhaps other owners with you, co-owners, partners? How do you maximize the return on the investment that you've made in this professional practice? And then the last stage is kind of the transition, giving thought to the future. What is the exit plan that you have? And we'll talk a little bit further about that towards the end of the presentation. So you've got on your slide there 11 different points that go into a business plan. We won't go into those in detail here right now, but you can get the sense that it gives a real good overview of what you want to do, or if you're in practice right now, what you have done and where you want that practice to go in the future. The executive summary I've mentioned as point number 11 on here, and that's only from an operational standpoint or a production perspective. The executive summary is the last thing that you're probably going to write when you develop your business plan, but it's really the first thing that the reader of the plan is going to be seeing. And who gets to read the plan? Only those that you want to disclose that information to. And this business plan for you, parts of it, again, you can share with your staff and your team to help you to move forward. So that maybe is all that I'll talk about with respect to the plan. I know a little bit later we have an offer where we're going to extend a more detailed business plan. So that's one of the takeaways that our audience will be able to glean from today's session. What I would like to do is to move forward a little bit further into this and take a look at another way of looking at your business plan. And I like this because within a business plan, I really see 3 mini plans. So I'm going to talk a little bit about that very, very quickly. So again, as a medical professional, you have a very clear picture of the practice, of the type of work that you're going to be doing, the type of help that you're providing to those of us who are in society today. And you're going to have a target audience or your ideal patient or client, if you will, that you will have in mind. So use that information to help you better understand the potential within that space that you're going to be operating. And of course, in marketing, you've got product, price, place, promotion, all of those typical things that go into a marketing section of a business plan. Don't let that throw you off. The bottom line is you're trying to find out how large is the potential for your practice in the space that you're going to be operating within. And so think about the geography, the geographic space, the footprint that you're going to be calling your trading area, if I could use that term. What's the geographic span or reach that you would have to attract the type of patients that you would be bringing into your clinic or into your practice? The other side of the coin is how you set up and operate your practice. And that's all of the nuts and bolts of the space that you're going to operate from, the staff that you've got engaged, the costs involved in your operation. You decide how large a footprint you're going to have for your practice. And attached to each of those decisions will be different expenditures, which you'll have some measure of control over. So it's really getting a handle on that expenditure side of your business or your practice. And the third area is financing. Of course, if you take your revenue from your marketing side and your expenses from your operational side, do the math, and you can come up with a good idea as to what potential profit might be generated in your practice. So those are some very high-level things to take a look at with respect to developing your business plan. It's kind of the big picture. So I hope that that is helpful, and then, of course, the more detailed business plan that you'll have available to you a little bit later. But, of course, let's come back to your practice. This really is your business. So if you think for a moment, not so much as the medical specialist or practitioner, but think of yourself as an entrepreneur, as a business person. Now we need to get a sense as to what is the vision or the values that you want to instill or infuse into this practice that you've got set up. Stephen Covey is well known for his 7 habits of highly effective people. And I like the 7 habits that he talks about there. One of them is the aspect of sharpening the saw, which is basically one of the elements that's embodied within that is to always keep an eye that your focus for your business or your practice, keep the main thing the main thing. It's easy to get distracted and pulled in different areas. Now, maybe to a lesser extent for you in your professional practice because you know the nature of the work that you're all about, the type of services that you can provide, or in some cases products that would complement that. But for a lot of entrepreneurs, it's easy to be swayed by every request that would come your way. So keep focused and keep the main thing the main thing.
I think that applies too still in healthcare practices. If you can spend more of your time working with the ideal patient that gives you satisfaction as a healthcare provider, in many areas, you have the opportunity to be able to customize your practice to the key people that you want to have in your practice, which gives you a greater sense of accomplishment in the way that you manage a business. There will be geographic variances. Sometimes you have to accept every patient that comes in the door, but not always. So, we do have to make sure that we are identifying the ideal patient population, so the ideal patient population for your practice is the ones that come through your door.
Exactly. And when we talk about the ideal, of course, they would be aligned very closely to your area of expertise, your professional practice. So know your strengths, know your weaknesses. And you'll focus on your strengths, obviously. But if there are areas that you need to augment your practice, then maybe it's a matter of increasing your skill set to allow for those to the extent that that's possible, or perhaps bringing in a partner or having referrals that you can make out to other professionals that will complement the work that you are trying to do. Again, if you do have another partner that's in your practice, having a comprehensive agreement is definitely something that you would want. In a partnership, you'd call that a partnership agreement. In incorporated business, if I could just reflect to that, it would be a unanimous shareholders agreement is what you'd be dealing with. I would really encourage you, just as you are a professional, engage other competent professionals to help you in crafting all of this, because you can't be all things to all people. So you're not necessarily an accountant, you're not necessarily a lawyer, maybe you are, but you are a medical professional. And so in keeping with that, use the other expertise that you need to help move your practice forward.
And I'd like to just jump on that for a moment. I can't tell you how many healthcare practices that I've been at that do not have written agreements between their healthcare providers. So that's absolutely something essential that you need to do. Yes, you need to make sure that the agreement talks about dollars and cents and, your operating costs and how you're going to split that. That should be in place. Also, make sure that you've got some words in there about the amount of time and energy that you expect these people to have. Your healthcare staff need to give you access to when they're going to take holidays. And those are things that I don't see in many practices, and these are things that people get burnt on. Of course, the other thing is to talk about how you're going to manage the patient records. We call that an information manager agreement, and I have lots of resources on the website to help you with that piece. But having those agreements in place is a key step about organizing your business, and make sure that you have those things in place that will be reflected in your business plan.
So clear understanding of what's going to happen and who's responsible for what, and the what-if scenarios. That's really what a lot of these agreements are. So go into it with a clear understanding of what the game plan is, what the rules will be within, and abide by it. So let's talk for a moment about the team that you're going to have and the operational side. And again, you're going to be engaging other staff members that will help you. The office configuration, I know in my own world, I've had opportunity to talk with those involved in a medical practice that's currently undergoing discussions with the management company looking after the space that they have, and they're going to reconfigure the space to get better use. They have a lot of space that seems to be wasted in hallways and in areas that are being underutilized. So again, in these times, it's always prudent to take a look at where can you reduce expenditures, and in this case, their lease is coming up for renegotiation, so the timing is very good for them. So think about the office configuration, the staff, and the patient comfort. You want a comfortable environment to work in. You're there for 8-9 hours a day, probably, maybe even extended hours beyond that if your practice is, open earlier in the day or open later in the evening to meet the client needs. So depending upon your hours of operation, make it an area that people are comfortable, your staff, yourself, and your patients. Equipment, record keeping, billing processes, and Jean, as you've mentioned, the HR side of things, making sure that you've got good, clear understandings of what the roles and responsibilities are. So your HR policy handbook, probably for the employees, very important to be clear on that. Keeping track of information, and I know that there's a number of tools that are available to help use technology to improve the ability that you have to manage the important information. And of course, the other side of that is with all of these tools, you have to be very conscious of privacy and confidentiality that goes into looking after the information once you've collected it. So you'll only be collecting information that you need for your purposes to run the business and to keep track properly of the patient records. Record keeping and taxes, this is an important area. And again, I would encourage you, have around you that team of professionals, your accountant, your lawyer, business consultant, your insurance broker, your financial intermediary, your business coach. All of these players can play a role to help you to be more effective in running your practice and moving it forward. So we've touched a bit on things like the keeping of information. One point I'd like to maybe stress is the second bullet that I've got here, and that's basically your business bank account. Maybe not so much in your particular area here as a medical professional, but many entrepreneurs feel that they can run their business right out of their own personal banking account. At the very least, set up a separate bank account for your business-related or your professional practice-related transactions. Keeping that boundary between what's personal and what's business or professional practice, very important. It'll make your life so much less stressful if you can clearly show what is business or practice related versus what is personal. There'll be ways for you to pull money in from the practice into your own personal bank account for your own financial requirements, but make sure that you've got clear demarcation between what is personal and what is for the professional practice.
There's something that you mentioned, Jim, that we need to make sure that we've got the right people around us to be able to help us.
Mm-hmm.
And healthcare providers are experts in what they do as far as providing healthcare, but they may need those additional people, your accountant and business people, at those key points in time in your financial year. But a business coach is a great idea to be able to help you with all of those other things that happen the other 11 months out of the year. And you don't have to be all things to all people at all times. And maybe having a business coach is something that some of our healthcare practices haven't thought about. They've got a clinic manager who is helping with the operations, day-to-day stuff, but they don't always come with a business background. So
Mm-hmm.
having a business coach is a unique idea. And I think an important part that you can include is those helping people in your business plan.
Exactly. Yeah. So tap into the expertise that is available to you. Focus on what you do best and then engage others to help you in other areas that you still have to attend to. So one of the things that I'll just quickly mention again is there are all sorts of industry ratios. And the other night, just prior to this, I was on gathering some information for a variety of different professionals that are in the healthcare field. So for physicians, for example, for dentists, for other healthcare professionals, and specifically I was looking at chiropractors. Not that I need one right at the moment, but someday I may require the services of a chiropractor. And then I also took a look at medical and diagnostic laboratories. And it was really interesting to see the profit margins that are applicable, the numbers of these types of professionals that are in operation right across Canada. And it was, the picture looks very good from a financial standpoint for each of these professions, some more so than others, but I'd be very pleased to, continue to carry on a conversation with those that are looking to improve these aspects of their business and work on their business plan with their go-forward strategy.
So one of the things to remember when you're working on developing your business plan is that you don't have to come up with these numbers out of the air. There are other resources available to you, like the information from StatsCan and Industry Canada, that are going to give you some guidelines about what is the average reported overhead cost for these different types of practices. So you don't have to dream them up. You can go to these resources. Jim has a number of resources that he can that he can help you with to be able to pull those numbers into your business plan.
Yeah, well, just maybe in wrapping up a couple of the comments here, further in the professional practice, succession planning. We've alluded to it earlier in the conversation that you should keep that in mind, but as you get closer to the end of that professional career, you need to take some steps as to what are you going to do with your professional practice. You've poured your life into this thing. It's an investment that you have made into your future. So there's different ways with my personal dentist. It worked out very nicely. Some of the siblings, the sons, of the founding professional took over the medical practice from their father, which was really an interesting story. So it continues that way. In other cases, you may bring in a partner that's looking at earning their way into the practice or buying you out at some point, or you may just look at kind of a sale of the practice at some point or transferring a patient load over to another professional practice. I guess in the worst case scenario, you're looking at winding it down. But the importance of succession planning, I can't overestimate or emphasize how important this is for you, particularly in smaller communities. If a small community loses its pharmacist or its doctor or its dentist or any of the other healthcare professionals, what are they going to do? So thinking longer term, and I know that's going to be on your mind too as a professional practitioner out there, is what's best for the community? How can you help them? That's why you got into this thing. So a business plan is certainly a part of that planning process at the start of a practice, as the practice grows and develops, and further down the road as you're looking to exit the practice. A business plan is a tool. For who? It's for you. But others will benefit from your having put thought and time into preparing a good business plan. And that's kind of what we do. we help people in the development of their business plans.
Right. Now, the succession planning is an important piece of that business plan, and one of the reasons that you need to revisit your business plan on a regular basis. Planning your succession plan takes time. So you want maybe 10 years of lead time. You don't have to make all the decisions today. And because you start your succession plan today, doesn't mean that you have to leave or retire from your practice right away. It takes time to put these things into place, but you'll only be prepared to do it when you've reviewed your business plan and planned your succession. So don't be afraid of planning it too far in advance.
Exactly.
What most people tell me is, my doc wants to retire the next couple of years and we're not the least bit ready. And sometimes I'll get docs saying, I want to retire in 6 months. And I'm going, that's just about impossible.
That's right. Just like in our personal lives, I mean, it takes time to build up your physical stamina and a healthy body, a healthy mindset. The same is true with your practice. I mean, putting a business plan together is not something to leave to the last moment. It's something that you should be working on and using on a regular basis. Lead time, I was doing a symposium on succession planning a number of years ago and helping to coordinate it. And the Business Development Bank of Canada brought in a speaker from the West Coast. And she was saying that some of the studies that they had seen with respect to succession planning, a number of years in advance of the planned date, 2 to 4, maybe even 5 years prior to the planned departure of the professional, saw an improvement, a significant improvement in the performance and in the value of that business or professional practice. Why? Because the owners or the professionals, they took time to develop their business plan and put pieces of information and systems into place to make the entire practice much more effective.
That makes a lot of sense.
Increase the selling price.
Great plan. Okay.
So we'd be pleased to chat with any who would like to spend some time in working in their business plan. And that's been great. I've enjoyed speaking with this audience here today. I'm hoping that I can help you in the future.
Thank you, Jim. You've shared with us a lot of really valuable information about a business plan. A question, how long in advance of starting a practice should you be working on developing your business plan?
Oh, okay. That's a good point. I know people that have been planning for several months, like half a year to a year in advance of launching the business. And why? They want to be very meticulous about how they go about the process. They don't want to be blindsided. They don't want to be rushed into things. So I would also encourage that if you're needing funding, one of the very first business loans that I made when I was an independent business account manager was to a dentist who, in the early stages of his career, he was looking at setting up a practice, and that was some 30 years ago. He put together a business plan and gave great thought as to what he was going to do, how he was going to set it up. I reviewed the business plan, and we were able to provide him with the funding through the federal government's Canada Small Business Financing Program, which is a great tool. Many financial institutions have financing programs with rates and terms very favorable to professionals right across the board, medical profession and many other professions. You folks are in good position to do well in negotiating these things with your financial service provider. So again, I've enjoyed the opportunity to work with professionals, and maybe I can help you too.
It's always great to be able to access people who have this information at their fingertips. You don't have to reinvent the wheel. You need to be able to find the right people that have the resources available to help you. In our series of interviews with our guest experts, we've got a number of interviews on the membership for our last 2 years worth of doing of interviews, of having people helping you find the right lease location, negotiating your leasing, looking at the equipment that you need to purchase. So we have a lot of resources from our very valued guests that can help you with those steps. But make sure that you have the opportunity to engage them in a timely fashion. So Jim has offered us a couple of specials that he can share with us. One is to email him, and he will send you a free copy of the detailed business plan outline. So if you're looking for a business plan for the first time, or perhaps you need to go back and revisit the business plan, send an email to Jim. There's a button on the page. You can send it directly to Jim at the email address pdf for you. So provision solutions for you at TELUS.net. And your other offer here, Jim.
Basically, for those that are on the front end of starting their practice and thinking about it, one of the tools that I've used is this particular one here, exploring business options, and that would be true of a professional practice as well. So this is an early stage exploration of what's ahead of you on that road towards your own professional practice. And then the last one that I'd maybe just mention to you is for those who are in business right now with their professional practice and maybe wanting to do something in terms of a spot check from time to time. We've set up a program over a 12-month period that's very flexible to offer both business coaching as well as mentorship, if you will, with respect to the business side of your practice. So we've got a discount that we'll tell you more about if you request that outline. In that outline, there's more details about a code that you can use to get a discount off of both of these services that we're making available prior to the end of this month, the month of May 2016. So we're offering that for you right now as a special promotion. And I know that will be helpful to you because it's helped many other professionals and business people to move forward with their hopes, their dreams, and their aspirations.
This is a really interesting offer, Jim. So if I'm in business now, maybe I've been in practice for a couple of years, I've got a clinic manager that I'm working with now. Can my clinic manager be involved in that mentoring and coaching because I trust her to do the operational stuff and I look at the big picture stuff at the end of the year?
I know a number of practices have gone to that route. I know a number of professionals that have that set up. And yes, by all means, if that's the designate that you would appoint to benefit from this type of a role, I'd be pleased upon your direction, professionals, upon your direction to provide that type of input to the office manager or whoever you feel would be appropriate.
Okay, so not only are we managing the business, we're providing an educational opportunity for our clinic managers and other people involved in our practice, which is only going to continue to add value to the practice and make sure that we continue to grow. This is a great service, and I think that this is really valuable for all of our businesses. That coaching and mentorship piece is really important. Thank you for that.
You're most welcome.
Okay. So I want to remind you that we are here every Thursday for our guest experts. If you would like a reminder every week to be sent to you about who our guest expert is and a reminder to be able to join the interview, please log into the website and sign up for the PMN podcast reminder. I want to thank you very much for joining us today for our practice management nugget with our guest expert today of Jim Ewing. We've talked about a business plan checkup for your healthcare practice. Jim has provided us valuable resources that you can ask him for by sending him an email. You just need to press that button. And also a discount on the services. If you are a new business practice that are looking at a practice or something that you want to do on a regular basis to be able to do some coaching and mentoring and growing your skills both as a business manager and perhaps the skills of other people in your practice, send an email to Jim and he will send you the information that you need to get started with that conversation with Jim. Thank you very much. This has been really valuable. Thank you.
Jean, I've really enjoyed the time with you today and with those who have been tuning in. Thank you and best of success to all of you.
This is Jean Eaton, your practice management mentor with Information Managers. Thank you for joining us today. I hope that you will look up the next guests on our interview podcast and be able to take a look at our archives. Thank you very much, and remember to stay tuned.